everybody. My name is Mustafa, and I'm a consultant in emergency medicine, James's, and I am one of the co-leads for IPPA Med. Thank you for all the panel, Dr. Bakarsha, Abdullah, Dr. Farah, um, for joining us today. What we're going to do today is we will go through one by one through all of you and ask your experiences, because most of you have sat on both sides of the table. And you have plenty of experience on both sides of the table on how things are going and what to answer and what not to answer. So, Dr. Bakarsha, I'm going to start with you because you've been on the interview panels for a long time, both virtual and face-to-face. You helped me prepare for my interview when I was doing my interview as a trainee for HST. So, can you guide me through what is the CSTEM interview process? How things go and what happens and how many people interview and everything? So if I am going tomorrow for an interview, what should I expect?
Okay, thanks very much, Mustafa, and best of luck to the participants next week. So this interview is basically for a CSTEM interview, and it's half an hour in total. And there are 3 stations. So what will happen is that at the start of, it's usually in the college hall, the main hall, the examination hall in the RCSI. So what happens is that at your allocated time, you will be waiting outside, and when the interview process starts, you will enter the hall. And what will happen is that depending upon how many parallel rows are running, so you will be assigned to one of the rows. And when the bell rings, usually the first station is a clinical approach station. So there are 3 stations. The first station is a clinical approach station, and every station is 10 minutes long. So the clinical approach station is that when you enter the station, it's different. I know I can't give you an example of MR Chem because in it, the kind of, the clinical scenario is outside the station. In this situation, you enter the station and we hand you over a sheet of paper. So be prepared for that. Usually the instructions given to the instructor is that, hand it over and give them 30 seconds. It may be 20 seconds, depending upon. So just be prepared for that. You enter the clinical station, you'll be handed a sheet of paper, and there'll be a minimal information, 2 or 3 lines. This 78-year-old gentleman and collapsed, and he's on this medication. And how would you approach to the assessment and management? So you read that, and then the next question he asks you, how will you assess this patient and manage this patient? So within that 30 seconds, you would have enough time that, look, what's the clinical scenario and how you're going to go? And the approach is very kind of, generic approach. Like, there will be 3 clinical scenarios. So one will be a clinical scenario, one is usually an ECG, one is usually an X-ray. So when I say you have 10 minutes, think about that for that first question, clinical scenario, you have 4 minutes. For the next question, which is usually an ECG, is usually 3 minutes. And then a last one is usually an X-ray, you have another 3 minutes. So distribute that time. Maybe for the first scenario, you give 5 minutes and then 2.5 minutes or 2.5 minutes. But this is the time. If you're bogged up too much in a clinical scenario or an ECG, you may have just the last 30 seconds, we throw off to you what's on the ECG. So kind of lose a bit of a marks. So keep that in mind that so far what I've seen is they're usually kind of a 3 portion of the clinical station. And in the first station, what is your general approach? If you keep a generic approach, you will never be wrong. So your ideal approach will always be what? You will start with kind of, A, B, C approach, history. Do you want me to go in full detail or just a bit introduction of the stations? I can't hear you, sorry.
Just a bit of introduction of the stations.
So that is the first 10 minutes that you will go through. Usually an ECG, and they're very typical kind of an ACLS kind of ECG, an ACLS kind of a scenario. And X-ray, very typical few scenarios where the X-rays kind of come. The next station, so a bell will ring, you will move toward the next station, which is usually kind of a knowledge and dedication to emergency medicine. And that's what we want to test that. Look, if you're interested in emergency medicine, how much do you know about emergency medicine in Ireland? So that is kind of, we test your general knowledge about, is this person really interested? If this person is interested, does he know what the training is like? Or he or she knows what the training is like? And what are the different aspects of emergency medicine in Ireland? I can give you a little bit more detail about that later on. The third station usually is suitability for a career. And I think that's the very important station. Because we say that, look, this person is not just getting onto the CSTEM, but am I looking at, is this person suitable to become a consultant in 7 years' time? So I think that's a kind of a station which really decides. Each station has 30 marks. There are 2 examiners. One examiner may ask all the questions, or what I have usually seen is kind of the questions are half asked by one examiner, half asked by the other examiner, and then they both mark, and then they sit down and they will mark you. But they will both sit down and they'll reach a consensus marks and they'll mark you. So basically you are kind of, the total marks is kind of a 90 marks, 30 marks each station and 10 minutes each.
Okay. So what I'm hearing is that there are 3 stations. The first is a clinical scenario, which is 3 clinical scenarios. So
yes.
Roughly. So
not a clinical scenario. Usually the first is a clinical scenario. The second
ECG
is ECG, like usually a spot diagnosis. How will you manage it? Like you can say clinical scenario, but it's more like, and the third is usually an X-ray and say, look, what's on the X-ray? And maybe related to X-ray, they might ask you a few questions.
So the first station is basically testing your clinical knowledge.
Exactly, yeah.
And your approach to the clinical scenario. And I would assume that you'd expect them to talk about airway, breathing, circulation, and a standardized approach.
Generic approach, if you keep that, yeah.
This is our approach. Then the second scenario, the second station is then you said, how much do they know about emergency medicine?
So it's mostly kind of a knowledge and dedication to emergency. Like I'll go to the different aspects of it. The first question they will always ask you, what do you know about emergency medicine training in Ireland? So you probably have 7-8 questions in that stations. You have 10 minutes. So keep in mind that every question they ask you, maybe the first 2-3 questions will be the major questions. So you probably have 2 minutes to answer each question. But the first 2 questions may be a bit longer, so maybe you give it 3 minutes, but pretty much you will have about there will be 8, 9, 10 questions that they'll ask you in that station. So they'll ask about what is the training program in Ireland. So you need to know, start from CSTEM to ASTEM, what are the different exams that needs to be done, what are the different kind of, training. You go 18 months in emergency medicine. What are, the different kind of all the 3 months kind of, training program that you have, what exams you need to do, kind of the human factors, the different courses that you do through the RCSI. Then you sit an ASAT exam. What is the structure of the FRChem exam? What are the training requirements in an FRChem? How many years is that? Like I've seen people who would say, look, I am going to sit the exam, and what exam are you going to sit? MRCP. So you could see that level of kind of, not being fully kind of, in tune with what the emergency medicine full 7 years of training in Ireland is. Other things they may ask you about is, have you done any exams? And I think that this kind of a vibe or interview doesn't go through your CV, but through these stations, it's an opportunity that whatever good things you have, just spell it out, like, tell the rest of the people. If they may ask you, have you done any exams? And I'm sure they'll ask you. So if you have done any MRChem exams, some people may have done the full exam. So just tell them at that point, what exams do you have done? But you should be very clear about what are the different parts of the exams. You should be fully know about the full training and all the exams. Always they're going to ask you, especially in any interview, and we ask even in for exams, why do you want to do emergency medicine? What makes a good EM doctor, those kind of things. And then what clinical experience you have in emergency medicine so far. So they will always ask you those questions. So have that in mind, kind of a sleek answer. I've done this is much emergency medicine at this level, at a registrar level, SHO level. They will always ask you about the life support courses you have done. Have you done any audits? And I think that's where you need to shine if you have done any. So I think I would probably say have 2 or 3 audits done. Any particular one that you have done, the results of those audits, or what was it about at, fingertips? Have you presented them, poster presentation on any of the conferences? And definitely ask you, have you done any oral or poster presentation? So they're going to ask you those kind of questions. This is the station number 2.
This is station number 2. And then station number 3 is suitability for EM.
Suitability for emergency medicine. So the kind of things they look for, it's, and I think they will always ask you, what are the big challenges emergency medicine is facing in Ireland? So in that, you need to know, like, this is a question they will always going to ask you, and this is a question they always ask you, even in the SPR interviews as well, ASTEM interviews. And I think you need to know what are the challenges. So think about it, what challenges would you put in? So this kind of a question I leave to the each imagination, but overcrowding, we all know. It's a big challenge, okay? So think about, you're going to say the challenges. Retention. Yeah, exactly. And the second one, recruitment and retention. What is the third one? We have faced a big challenge. We say, look, COVID was a big challenge we faced, but then it was also an opportunity that we learned so many things from it. Or maybe if somebody else knows. So 3 big challenges, yeah. NCHDs at level, definitely recruitment and retention, we said. So that kind of comes as a part of it, the kind of working atmosphere that we are working in. If anybody knows a 4th challenge or 5th challenge, naturally you can go and say. And then the next thing they're going to ask you, definitely, what are the solutions to those challenges then? So this is more like
generic thing prepared in their head.
Yeah, prepared in their head. They're going to ask you about the challenges, and they're going to ask you about the solutions. So have some kind of, solutions or challenges. You can read, go through the IAM kind of thing website, and you would see a lot of the issues which are being discussed there. So naturally, whatever your answers are, or, your challenges or your knowledge about the challenges the emergency medicine is facing is in line with what the IAM is telling us. So you can pretty much, go through their,
go to the IAM website, look at the IAM press releases, etc.
Press releases, and you'll have an idea.
Yeah. Okay. Thank you very much, Fakarsa, for the overview. I'm going to come back to you, Abdullah. Yes. So you have been through the training process very recently, right? You went for now. It's been a while since you went through your BST interview. However, it is not as long as I had been. So tell me that if you've got an interview on Tuesday and today, what are you going to go through in the next 48 hours? Okay. How are you going to prepare in the last 48 hours for it?
Yeah, so I think at this stage, so firstly, thank you for inviting me here. So I think at this stage, whatever you have done so far for everybody on your CV, when you have whatever audit you needed to do or whatever presentations you had to do, that's done. So at this stage, what I would say is the most important thing that you should know is how to basically sell yourself, how to highlight the important and relevant stuff from your CV. What I personally did was, as Dr. Wakar was saying, we know there's going to be 3 stations, and we kind of know the theme around each of those stations. So I wrote down the possible questions for each station, and I practiced them with the people who had either recently gone through the interview process, or people, or even the SPRs who were there at the time where I was working. So I think that was very helpful. So for each particular question, what I would advise is, so for example, starting from the clinical scenario, it's going to be a very straightforward scenario. It's not going to be very complicated, but you should have, as Dr. Wakar was saying, a general theme or approach in mind. So always start with ABCs. Make sure whatever you're doing, that the most important thing is patient safety. So make sure, whatever you are saying goes around that. From my particular question, I had a sepsis, which I was trying to refer to the medical registrar, and there was also a bit of conflict resolution around that, where the medical reg had said that they will discharge the patient back. So, you should say, if there's anything like that, that you would not let this happen. So say out those words. You will go back, you will talk to the medical reg. Obviously, again, if that doesn't work, you will escalate that to your reg or your consultant as needed. So that's for the clinical scenario. Then for your CV, they asked me to kind of walk through the CV. So tell us about yourself is how that particular station started. So again, for each one of you, you should know how to start off the answer to this particular question. So for example, obviously you need to filter out the relevant stuff and leave out the irrelevant stuff. So for myself, I told them so I had done my house job from Pakistan in one of the largest trauma centers. So I made sure I mentioned that. So, you say that I had the opportunity to do internship, and then that's where I started liking emergency medicine, and that's where my passion for emergency medicine developed. I saw that the people who are in emergency medicine, they were making decisions and giving treatment at the front door and all of those things. And that's where I started liking emergency medicine. So, just having kind of a template in your mind whenever of what you're going to say. And then in this station as well, as Dr. Vakar was saying, they asked about the audit. So I had an audit. So if you're going to mention an audit, make sure you know your results and you know the numbers. So if you mention it, you should know what you did, what the results were, and all that. In terms of the third station, they will particularly ask you, as we mentioned earlier, about the training scheme. So make sure you know what it is. If you don't, you can go to even emnow.ie. That's another website as well, where you can find a document which will tell you about the training scheme. So the other question on this was, where do you see yourself in 5 years' time? Where do you see yourself in 10 years' time? So all of these questions, make sure you're prepared to answer them in your as per your own CV and all that. The other thing I will say also is, so because these are three different, so for each station you will have two different consultants. So even if you are repeating, so for example, in your CV stuff, so whatever you said there, you can also, if it is relevant to the question being asked in the next station, if it's one of your strongest points or stronger points, you can mention that again, because they won't know what you have said in the previous station. So whatever it is, you can mention that again. So it's just very important to highlight whatever you have done. Make sure how to say that, practice that with someone, practice that in front of a mirror. I practice a lot in my head even. So whatever works for you, just keep practicing. And that's basically how I prepared.
Thank you very much, Abdullah. That was very comprehensive account of preparation that you went through each of the stations and how, and I suppose the most important thing that you mentioned is practice, practice, and practice, and keep on repeating yourself, keep on practicing. If you can't find anyone, suppose practice with your partner, your children, your wife, your whoever, your roommates, your whoever you find, just keep repeating that answer. And one thing that I would tell all the people is that record yourself in with your mobile camera and then play it back again to yourself. And sometimes you will notice that you flutter some words, that you're not very clear in pronouncing certain things, and keep it back and bring it back over and over again. Thank you very much for that, Abdullah. Dr. Farah, so we have heard the process, what is the interview process like, and we have heard, Abdullah, how to prepare. I'm going to ask you, been on both sides of the table. So can you tell me what are the do's and don'ts? If I'm going for an interview tomorrow, so yes, I prepared and I'm well prepared by now. I've gone through EM Now website, etc., etc. But what are the do's and don'ts of the interview? Bushra, I can see that your hand is up. Can I ask all the people who have any question, can you type it in the chat box and we'll answer them? So Dr. Farah, over to you, please.
Thank you, Mustafa. Dr. Vakar and Abdullah have covered pretty comprehensively. I would say the biggest do is be prepared, whether it's your preparation for how you appear, how you present yourself. And remember, your first impression matters a lot. So make sure you feel good in yourself, you feel confident in yourself. Choose your suit or dress or whatever you're going to wear, your hairdo, if you want to go to the barbers or hairdresser, whatever makes you feel good in your skin. Get that done. There's nothing worse than trying to go to your wardrobe morning of the interview. What do I wear? You've prepared so well and you don't know what you're going to be wearing wrong. Make sure you get there in time. Anything that can throw you off, anything that can shake your confidence, eliminate those what ifs for the day of the interview. So be there well in advance, well in time. If you're traveling from a different city, stay the night before, whatever gets you there in time. So that'd be one of the biggest do's, your preparation, whether it is for how you present yourself, your preparation for the interview, how you talk, how you behave, your walk, the way you talk, video yourself, practice with someone. That I would say is the biggest do. The one don't I would say is, don't let anyone or anything tell you you're not good enough for it. There are no trick questions there. They are there to gauge your suitability for emergency medicine, not to gauge your unsuitability for emergency medicine, you know. So the ones who are interviewing, they want good people in their specialty. So if you're good, they want you. They're not there to not have you, they're there to have you. So like, when you're presenting yourself, like Abdullah was saying, this is your time to sell yourself. You've got 8 minutes per station to sell yourself. Make sure you know how you're going to do that. So your CV, practice it so well that you can say it in your dream, that you can say it in your sleep, you know. And then what do you like about emergency medicine? What do you not like? Like, which aspect do you not like about emergency medicine? What are your strengths? What are your weaknesses? If you're talking about something that you don't like, make sure, how do you change that, that you have an answer to that. You're not there to whine, you're not there to complain, you're there as a person who has solutions to things. You mention your strengths, fair enough. If you're talking about one of your weaknesses, now is not the time for honesty. You're not actually giving them a weakness which is actually a weakness. You are giving them something which you can turn around as a strength. For example, some people like talking about, I take on too many responsibilities and I struggle to then find a good work-life balance or things like that. Okay, don't make yourself sound like you're somebody who's going to burn out in the next year or something like that. Find a weakness that you can convert into a strength during that interview. And when you're presenting that as a weakness, people say, oh, that's actually a strength. But yeah, they're recognizing it a weakness, but they know how to turn it around as well. So practice those questions well. Like Abdullah was saying, if there are any audits, make sure you know them. And make sure you know what is an audit. Don't present an observational study like an audit. An audit is where you have measured your practice against a standard. Anything other than that is not an audit. An audit has to have a first cycle, an implementation or change in practice, and then you remeasure yourself. Anything other than that is not an audit. An observational study is not equal to an audit. The challenges in emergency medicine is where I think Abdullah and Dr. Wakar also said that's a discriminatory station where if you're talking about a challenge in emergency medicine, make sure you have solutions to that. There is no reason why you shouldn't prepare very well for that, just like you would prepare for any exams. If you present to an exam viva and if you're struggling to find answers to really simple questions, that doesn't set you across as a candidate who is prepared for it. You wouldn't do anything less for this interview. So the challenge is whether you go through IAEM newsletters or emergency medicine program, you should all know about an EMP, emergency medicine program, and you should all be able to refer to those documents, the emergency medicine program, the newsletters on IAEM, the ARCM documents and ARCM guidelines. You should all know them and mention them, refer to them. That just says you have done your research. You're actually interested in emergency medicine. What qualities would you like to see in a consultant? And kind of, if you have done any researches, if you have done any audits, know them very well, know your CV very well. I suppose clinical stations are probably the easiest ones in the entire interview. Like Dr. Wakar was saying, and like Abdullah was saying, they are very straightforward stations, but make sure you focus on the question. So the biggest do here is know what the examiner, what the interviewer is asking you. Don't beat about the bush. For the case, have your ABCDE approach and you won't get it wrong. For the X-rays or ECGs, if they've asked you for a spot diagnosis, don't go into anything other than spot diagnosis as the opening sentence. So if you have an X-ray of tension pneumothorax, and when they show you the X-ray, the first word that should come out of your mouth is it's a tension pneumothorax, instead of going into, I would examine the patient, assess the patient, do this, do that. No, if they're asking for a spot diagnosis, go with a spot diagnosis. If they've given you a scenario and they've asked you for a spot diagnosis where it sounds like a DKA or a bifascicular block on the ECG, now bifascicular block on the ECG is one of the very hot favorites for whatever reason. So know that ECG. So the biggest do, I would say, again, to summarize, is prepare yourself. and prepare in every aspect. The biggest don't is don't underestimate yourself. Make sure you sell yourself well. Mustafa, you're
Thank
on
you
mute, I
very
think.
much, Dr. Farah. That was a very good overview of do's and don'ts. So if I summarize what you've said is tomorrow go and buy yourself a suit, or if you don't have one, get your wardrobe ready. Go to a barber. Unlike me, I don't need a barber. But for most other people, might need a barber. So go to a barber, get yourself. You should be looking sharp, and that is what Dr. Vakar told me when I was going for my SPR interview. That go pick out a suit tonight. You don't have to do anything else. Just go pick out your suit. Look elegant. Look like someone that I would like to work with in next couple of years, or you would like to work with in the next couple of years. So that is the first do that that is even before everything else. The second thing then, uh, if you're stuck at a question, you can't understand what you're asking. I suppose there is no harm in asking the examiner to repeat the question. Listen, I can't understand what you're asking. Can you repeat the question to me? Rather than going in a completely wrong direction, because remember, you are time limited. These are 10 minutes. The bell will ring. You will be moved to the next station. And if you go into a wrong direction, you have missed the boat. So don't miss the boat. If you think that you are missing the boat, stop, pause. They're there to help you through the interview, not to kick you out of the room. They're there to support you and see your suitability, right? And what someone else told me is prepare for the most feared question first. For example, what are your weaknesses? Most people, or if someone's research CV doesn't look, you haven't done any audits. Why is that so? Some of you might not have any audits at all. So why is that so? You should have a good, well prepared answer that in the last, I've only been in Ireland for the last 6 months, which some of you might be. And in the last 6 months, I was doing this, and I'm planning to do this audit. So know the basic definitions between what is an audit, what is a guideline, all those kind of things. A question there is from Bushra is, I'm coming from Pakistan just for this interview and I don't have Irish clinical experience. Do they select such type of candidates? Bushra, what I would say is that if you have been shortlisted, that means that you're eligible for this interview. Okay, you're eligible. They found you appointable for the post. So the shortlisting process is a very clinical, strategic process. We don't shortlist randomly people. If they've seen your CV, they've seen that your CV is competent enough to be appointable. So you've been considered appointable. And this interview is going to decide whether you should be appointed or not. Now, not having Irish or UK experience might come as a barrier to your knowledge. So not having Irish experience would not be the reason that you're not selected, if at all you're not selected. It would be that there might be certain barriers in how Irish system works, how UK system works. What Abdullah has mentioned, what Vakar Shah has mentioned is go through IAEM website, go through EM now, and you will find a lot of the questions that might be going in your head. How is Irish emergency medicine training program? What are different fellowships? What are different exams? Another question that I have there from Ibrahim is, what things we should avoid saying if we are stuck at some point? Vakar, Abdullah, Dr. Farah, anyone?
I think it's just coming to the same question. What are the things, and especially the first question as well, there will be a different kind of, doctors with different experiences, different kind of, time that they are going through their career. So the main aim, and especially when it comes down to the end, is there will be interns, there will be first-year SHOs who will be interviewing for this, and there will be some of us who are quite experienced and registrars and done MRChem exam. So I think the most important thing what we are looking for in the interview and deciding is that, fine, whatever stage in their career they are or they have experiences, does this person have a potential that during the 7 years they will progress in their career, become an emergency medicine consultant? Because this is a CSTEM interview, but this is not just a CSTEM interview. We're looking at potential candidates who will go through the 7 years training program, and will they come out as consultants in emergency medicine and will add to the specialty of emergency medicine and will be useful as colleagues. So I think keep that in mind. Your lack of experience or your over experience, clinical experience, actually is not going to help you much. It's more like how you're going to convince the panel who's sitting there to say, does this person have a potential that if given an opportunity, they're going to progress through a career, they have the right frame of mind, they're the right people who actually are suitable for emergency medicine. So I think that's the most important thing. So don't think that, well, I have less experience, so I think I am at a deficit, or I have more experience. Some of you may have very strong CVs, but it doesn't mean you will be, that person will be considered as more suitable. Some of the things which you don't say, I think it all comes down to you are selling yourself as I am the right candidate, I am the suitable candidate. And I think you somehow have to convince the examiners, the panel in front of you to say, so don't feel kind of, feel confident about whatever you say. Are you the person? Yes, I am the best person. And I am because these are my qualities, which are required for what generally a good doctor should be, or generally they're going to ask you, what are the qualities of a good emergency medicine physician? And if you know those qualities, you'll kind of project those qualities through personal examples. So very much they're going to ask you, give an example from your personal experience, your clinical experience that you've been working, which shows that you can handle, kind of a difficult situation, whether it's a clinical situation or out of a clinical situation in a workplace. So give those kind of examples from your personal work life, and I think that makes it very relevant. They want to see the exact person, they just don't want to see a person who's giving the right answers, but they just want to see a person who, because of their personal experiences and personal qualities, is the one that they are looking for, who fits the criteria, fits the person who they're looking for. So I think make it more like kind of a real and something about you, rather than you just want to give them the right answer, whether it reflects whether that it is you that you're talking about, or is it some kind of an ideal person you're talking about. So I think, and be prepared, like they could ask you all those questions. And they say it's a predictable interview. They're going to ask you all those kind of things. What are your strengths? What are your weaknesses? Tell me a situation where you came to and how did you came out of it and how did you handle it? So these are all the questions which they're going to ask you. So don't be quiet, give an example, think about it for 5-10 seconds, and there's always an answer to it.
Perfect. Dr. Farah, do you want to add anything to it?
So the one thing I would add to it is don't undersell yourself. If you don't have an answer to a question, for example, like why haven't you done an audit, or what audits have you done, or what research or what publications, have an alternative for that. So for example, the reason why I haven't done an audit or haven't been able to give much attention to that area is because I was busy or I was paying attention to something else. It could be a degree, a diploma, master's, and that then shines out. So alternate it with something that shines out in your CV. It doesn't have to be academic. It doesn't have to be clinical. It could be something totally non-clinical, because I was playing in the national cricket team or whatever it is, like you were busy doing something else which was as productive as what you've been asked here. And it's important, and you're going to be coming to it at a later stage, but you had something else very important that you were doing in this time. Make sure you highlight the star achievements in your CV, whether it's an academic achievement or a non-academic achievement. Bring it in the conversation, and it's up to you how you bring it in the conversation. The one thing Dr. Waqar was talking about, tell us about a situation and how you came out of the situation. Not the last 2 years, before that, there was a kind of a trend where there was a weird or wonderful question. For example, you have gone to the hospital canteen and you hear somebody talking about you. How would you handle that? Or you were in a bus and the people around you in the bus, how do they perceive you, or what do they think about you when they see you? So the candidates were like, I don't understand, what do they want to know here? And I was like, put yourself in the interviewer's shoe. When they're asking this question, what do they want to know? They want to know what kind of a person you are, and how do you respond to a situation when somebody else sees you? How do they see you when you're at work or when you're outside work? How are you perceived? What is your personality like? So I suppose that's the kind of thing the interviewer is looking for when they're asking those questions that can throw you off otherwise. So if you have been asked a question, now I'm not talking about clinical scenarios. Clinical scenarios are clinical scenarios. There are no tricks there. The kind of suitability for emergency medicine or CV stations, if they ask you a question which bowls you, or like which is like a bouncer, have a strategy as to how you're going to deal with that question, and how are you going to divert it to something you can do very well then.
Perfect. So essentially, the interview is about you, and you should be leading the interview. You know, you take the interviewer in the direction you want them to. If you've got a brilliant, so in my SPR interview, I was asked, you've got, and not asked, I was told actually that your research CV is shockingly poor. Have you any explanation for it? Okay. And at an SPR interview, when your adrenaline level is high, this could really throw one off. Okay. But at that point, I was as worried as I was that it was shockingly poor. I was like, so my question, the way I turned it around is that I know my research CV is really, really poor, but there's a good reason for it. And the reason for that is that I've been in Ireland only for last 18 months. And over the course of last 18 months, I've done all my membership exams. I've done ATLS, I've done ACLS, I've done APLS, I've done this. And if you look at it, so I've spent over this amount of time getting to this and making myself eligible for this interview today. I understand there are still certain shortcomings in my CV, but I'm hoping that over the course of next 5 years as an SPR in emergency medicine, I'm going to build up my research portfolio, and these are my research ideas that I want to do in next couple of years. So that is how you give a very negative question a very positive spin. The interview is about you and how brilliant you are. It is not about, and the interviewer wants to know how brilliant you are. He's not there to push you over the wall. They want to get the best candidate out. And that is what this process is all about. I'm going to open this to the room. If there are any questions that anyone else has, please share them on the chat box, or you can raise your hand up and we can let you through. So one other question is your strengths and your weaknesses. So Dr. Farah, Dr. Vakar, do you want to go through, because that is one thing that people really struggle with, that what are my strengths? Strengths are fine, but weaknesses people generally struggle with, that what are your weaknesses? How do I present a weakness?
I think this is,
Abdullah.
yeah, Dr. Abdullah, yeah, go ahead.
Yeah, I think, yeah. So one of the things I will say, just to maybe add on to the previous one as well, is if you don't know an answer to something, don't make up the answer, or don't say something which you haven't done, or, lie about anything. So obviously the person interviewing, they have plenty of experience. They can immediately tell whatever you're saying. So be confident, make sure you say whatever you say the truth, and give examples for everything, as Dr. Vakar was saying. So when I got asked these questions about the strengths, so these two questions are going to be asked. So they will ask you what are your strengths, and give an example of each one of your strengths. So that depends completely on you how you're going to answer this. So everyone has different strengths. So write down whatever way, say it in your head, practice, and remember your strengths, and make sure you give examples with each one of the strengths that you are going to mention. And then for the weakness as well, every one of you will have different weaknesses. And as Dr. Farah has said, make sure that whatever weakness you are going to say, say how what have you done about it. And that just shows that you have recognized this as your weakness, and now you're working on it to improve it or convert it into a possible strength of yours. So practice it as many times as it takes you to get the flow right. And because that's what, when I started practicing, because first when I had it in my head, it's a lot different when you are sitting in front of somebody and saying those things, and then you know where you're going to stutter, where you're going to pause. So make sure you keep practicing these questions over and over again. And as we've previously mentioned, whether it's your partner, a friend, a roommate, whoever you're with, make sure you have someone physically there listening to you. Write down the questions, give it to them. They can ask you all these questions. So yeah, that's what I'll have to say on that.
I think just
So
to
I
add a few things to it, this is kind of a station where they check the suitability for emergency medicine. And I think that's kind of the most important station which they decide whether you're suitable for that. And they would probably ask you the strengths in relevance to what strengths do you have that make you kind of suitable for emergency medicine. So at the one time they're looking for, yeah, what are the kind of, qualities of an ideal emergency medicine doctor? And then are you aware of that? Or in other words, if you can direct it toward yourself, what strengths do you have which make it suitable for emergency medicine? They will definitely ask you about the weakness. And as Dr. Farah said, she has given some very good, excellent answers. In a way, you say, look, give it kind of a positive spin. Everybody has some weaknesses, but give it a positive spin and say, look, this is something which I don't have experience much, but I would like to learn it. And I think when I'm giving this opportunity, that's what I'm planning to do about it. So give it a positive spin. Don't say, look, I have a weakness, but then you have a bit of a deficiency, you want to get more experience. Put it this way. And if I'm given opportunity, that's what I plan to do about it. They will always ask you, what are the things you like about emergency medicine? And it has all its challenges. So be aware of that. What are the challenges, or what are the things you don't like about emergency medicine, or what are the things you like best about emergency medicine? So those are the kind of things which they're going to ask you. And yes, there are, some challenges in emergency medicine, work-life balance and unsociable hours, and, a big kind of a burnout. So you're aware of those. It's not that, God, you are going in there and people say, what do you like best about emergency medicine? And the question and the answer which you usually get is, I go into a ER and, the major traumas and the adrenaline rush, and we'll say, look, that's only probably 1-2% of all the things you'd see. You'll see all the elderly people and all the other things. So have kind of an answer. You have an understanding of why you want to do emergency medicine. Don't give an answer, I want just adrenaline rush. That's a very small part of it. It means that you're probably not very familiar of what an emergency medicine in Ireland is. If you go through a cubicle every morning, every 90% of your patients are above 80 years of age. And they're lying there. So have kind of an idea, what are the challenges? Why do you like it? It makes you that feel like or look like that you know how it is, and you're honestly like it, and you have the right attitude for it for emergency medicine. So these are the things which they're going to definitely ask you, and have kind of questions in mind. What are your answers going to be?
So I would like to share something about, I know weakness, what is your weakness is something that throws off everyone, and nobody wants to kind of give a bad weakness or whatever. So and each of you should have your own answer with your own stamp on it. Don't copy anybody else's. If somebody asks me today, what is my biggest weakness? I would say very honestly that my weakness is I get very irritated with unnecessary obstruction in referring patients to their specialties, right? This shows I care about the patient and I want the right thing for the patient. So while it's a weakness that I'm getting irritated about it, it's giving a message to the interviewer that I care for the patient. Now, I can't just stop here and say, this is my weakness that I get irritated when the teams refuse to accept the patient or put unnecessary obstructions or whatever. How do I turn it around, right? I can't just get angry and throw a tantrum on the floor and then be off. So how do I turn it around? So I couple it with one of my strengths and I say, this irritates me, but communication is one of my strengths. So when I get irritated about it, I keep myself calm, I keep myself cool. I pause for a minute and then I rephrase the scenario to make sure I'm emphasizing the clinical necessity to the person in front of me or to the specialty doctor. And if that specialty doctor still doesn't understand, I then approach the consultant of that team. Now, I can do that as a consultant. You then talk to your registrar and your registrar pitches it up to the higher person. And then what further can you do? So then I try to make this conflict into a healthier situation where I call for a meeting or I call for a guideline or pathway development or something like that. And I've tried to do a diploma in leadership. So when I'm presented with these scenarios, I'm learning how to deal with them better. So what is your weakness? How do you overcome it with one of the strengths? What do you learn out of that? What does your department or the hospital, how does your department or hospital benefit from that weakness of yours? And what positive do you get out of that? You don't just give them a weakness and walk away. you change it into something very positive and very powerful then.
That's great. That's amazing explanation of all of it. A few things, which are we've gone through do's and don'ts. So few things that are don'ts is don't come across as a cocky, super talented, absolutely wonderful SHO. Remember, this is a CSTEM interview. You are joining the training scheme. If I'm asking you your strengths, I don't want to know that you have done 10 surgical airways, or, I'm the best intubator in my class, or, I've done 200 CVC lines. You might have that experience, but that is not going to come across nicely. Okay. So, keep that in mind that what I want is someone who's eager to learn, not someone who's already very, very, very learned and has all the skills. Remember that you're coming here to learn, and you're coming here to learn and go forth as a consultant in the next 7 years' time. So that is one of the things. Someone has asked a question: the difference between Irish and UK training schemes. I think that's not very relevant to today's session. What should be the answer of the question if you are in a cafeteria and somebody's talking harsh about you? How can we answer it? So I'll open this to the panel again. That
I
if
think
this is the
the
question.
question, probably this would be the last question as you are leaving the suitability for emergency medicine. And they just, and it's a question which they ask about you and they say, look, if I ask you, how would you be described in 4 words? Or if I ask your best friend to describe you, what will the best friend say about you? So they will always kind of in some way try to see that what do you think are your qualities? And you probably, this will you like 10 seconds or when you're leaving the station. It's up to you whether how you're going to say, what are the basic qualities? And you tend to be honest. And that's why when you're honest, you say those things. You say, look, I am hardworking, I'm reliable, I am team leadership qualities, I'm a team player. So something like this, this is what I just thought I might say. So these are either personal qualities plus also, work-based qualities. So they will always ask you that. If you describe yourself in 4 words, what would you say? If we ask your best friend to describe you in 4 words, how would you say? Now, the question was slightly different, harsh words. I don't know, Dr. Farah, you probably are giving a very right political answer. So I leave that to you or Abdullah. So what do you think?
So I suppose the one thing you wouldn't want to do there, you wouldn't want to start a quarrel or something like that. You won't go and just to start fighting. How dare you, So if I can't exactly remember whether it was they are talking, you overhear them talking about you, and how would you deal with that? Or was it that they were talking negative about you, and how would you deal with that? So you won't confront them upfront. You would find an opportunity, invite them to come in. Now, this is the way I would deal with it, okay? And each of you can have your own way of dealing with it. You would invite them to a space. If you have already had any fights with them, then you wouldn't do that as a one-to-one. You would have somebody you trust and invite them to bring someone they trust along to that conversation. And if it's a personal problem, you would try to iron it out. If it was an issue about a patient referral or a patient care, you would clarify that situation with them and say it wasn't personal, it was all about patient care. Like whatever was the issue, you try to resolve that issue on a one-to-one level. If one-to-one level isn't appropriate, then have another person with you, have them another person with you. If it still doesn't resolve, then get a senior involved, or do you need to involve HR or something like that? Is it dignity at work? Is it bullying at work? Or what is involved here, right? So do you know those buzzwords like dignity, medical council, or HSE dignity at work policy, bullying at work policy? So I'm not exactly 100% because I wasn't there at the interview.
Can I add just one thing to it? I think this is a very pet question. This is a must question at the SPR interview. But this is, those kind of an exactly dignity of work, I think. But I don't think so it's ever been asked or go this way, conflict resolution and things like that at a CSTEM level. So I don't think so, but it's a must part of the 8 stations in SPR interviews.
Yes, again, if a question like this is asked, is thrown at you, so, and how to give it a positive sense in an interview, so the interview is all about you and to tell them how magnificent you are. You could be a completely awkward person in your personal life, but in an interview, you have to put your best foot forward. Okay. So if this question is asked to me that someone was talking harsh about you or saying something negative about you in the canteen, so the way I would do is that I will take that as a negative feedback. I will think about it. What was it about? Was it about my clinical acumen? Was it about my behavior, interpersonal skills? Was it about my interaction with the patient? And I'm going to self-analyze, and I'm going to discuss it with my mentor at my, at my school, at my department, with my consultant, that, this is the kind of feedback I've heard about me, and I want to improve upon it. And how can I improve upon it? So I'm going to take that as a feedback mechanism, and I'm going to work on it and try and build myself, my personality up to come to a level that things like that don't happen again. So that is where I'm going to seal it off. I wouldn't, go into further, particularly at a CSTEM level. Again, remember, interview is all about how magnificent you are. So I don't want a troublemaker. So if I'm interviewing for a CSTEM, as SHO, so the least person that I want is someone who's going to create more trouble for me tomorrow. What I'm looking for is a person who would be resolving conflicts rather than creating conflicts. So I'm looking for someone who's looking at things, how to resolve things rather than create. So this is how I'm going to tackle any trick question. That, listen, I'm going to take that as a feedback. I'm going to discuss it with my mentors. I'm going to go to my consultant, and I am going to improve upon so that things don't happen again. Some give it a positive spin.
I think that's an
Mustafa, your answer
excellent
is like,
answer, Mustafa.
yeah,
That's
your
an
answer is a
excellent
20
answer.
out of 10. It's amazing. It's very
It's
well
a,
answered, very well
it's a
approached.
it shows your quality that you can have a self-reflective kind of a thing. If you see something about yourself, think about it. Is it really genuinely right? It's an opportunity for me to improve upon it. And I think that's an excellent answer. If you give that answer in the interview, you'll get 20 out of 10. That is an excellent answer.
This is the kind of spin that I would put on it. Again, in personal life, I might go and personally confront the person, but that's my personal life. That's not my interview. In my interview, I'm putting my best face forward, and this is my best face. So have we any other questions from the panel? We have got 8 from the participants. We have got 8 minutes left. And in those 8 minutes, if there are any burning questions, any questions that you are scared to answer, any questions that you are, you don't know how to give the best wording formation for it, please let us know so that we can answer them, because this opportunity, you won't get it again. Professor Mukhtar, Dr. Khalid Khan, and I think Dr. Haroon Khan are there with us as well. If you've got any generic advice, Khalid Saab, Mukhtar Saab, Haroon Saab, for our candidates, please let them know as well. Any other burning questions? Any other last minute advice, Dr. Farah, that you'd like to give to our candidates? Dr. Mukhtar, Professor Mukhtar Saab.
जी अस्सलाम वालेकुम सॉरी मैं sorry Khalid बोल रहा हूँ. Can you hear me?
Yes, Khalid Saab. So
Yes, we can.
No, I think no, excellent. I think you three have given, rather 4 of you have given excellent kind of summary and overview and questions. I think the more important thing is prepare yourself, as we've been saying in other interviews. Prepare your answers well and practice them questions. So think about scenarios. Talk to the people who have done the interviews before, seniors and also juniors who have done last year. Prepare a set of questions and prepare your answer how you will address that. This is the key. And then, as I think you all have mentioned, that there are weaknesses in every CV. I won't say weakness, but turn around and make them more positive. That's very important as well. And tackle every question as you want to show the best, as Mustafa just given the example now. Don't be kind of under pressure. If you have any awkward question coming, think about the positivity from that question and use the opportunity. I think I'll just summarize this. Okay.
Professor Mukhtar Shah, have you anything to add?
No, thanks. I think it's excellent. You all have explained very well. Only one suggestion. I think one question was asked from, I think, from the girl from Pakistan who is shortlisted. and while asking whether there is chances to get the selection here or not. I think there's one opportunity when you are not working in the system. There is advantages and disadvantages, and advantage is that expectations are not as high. If like you mentioned the websites, if that person can go through all the websites and know the system, how system works, and what's the pathway, and answer very positively on that one, and also can talk with the get the advice from you guys, and can say that I took the advice, people who are working there, and I'm very keen to join, and these are the positivity. I think there are a lot of advantage, because sometimes if you work in the system and you can't answer properly, that goes negatively rather than positively. That's just want to add on and motivate the person sitting in Pakistan.
Thank you, Mukhtar sir. Thank you very much for that. So any last minute advice from the panel for our candidates?
So I would like to support what Professor Mukhtar has said. For the person who's doing the interview from Pakistan, who's come here for the interview in particular, working in Pakistan doesn't mean you haven't practiced evidence-based, guideline-based emergency medicine. There are many centers in Pakistan, and you'll find out when you're working in Ireland, that are doing better emergency medicine than what you find here in some hospitals in Ireland. So if you are working in a center which practices really good emergency medicine, highlight that, make that shine out in your interview.
Just one advice, and that's based on what we had discussion in one of the SPR interviews, and it applies the same to the CSTEM interviews. I know we are coming from Pakistan. We may not have the same fluency in speaking. We may not have the same kind of accent, but I think what really was discussed in the interview was, what is the most important thing, presentation or content? And I think what I would say is, when you are in there, feel confident, feel good about yourself. When you feel good about yourself in station, it will reflect on your expression and the way you're talking. And talk in your own accent, whatever it is. Talk at your own speed, but the content is the most important thing. So if you say the right things which you have done, it doesn't matter which way you say it, that will decide whether how you perform the interview. So go in there confidently. You're the best candidate. Have your answers ready, talk at your own pace, what you normally talk, and I think that's the most important thing. So content is more important than presentation. Presentation is important, but content is the more important thing here.
Perfect. So, Abdullah, have you any last word of advice for our candidates?
Yeah, no, I would just kind of reinforce this. So, you have all of you who are appearing for the interview. You have been selected for the interview, so they think you are suitable for emergency medicine. So go in believing that, and keep positive, and I'm sure you're all going to do very well, and best of luck for the interview.
Thanks for that, Abdullah. So just to reiterate the fact that you all know the questions, the 3 stations, you know the questions, okay? There are no trick questions and no curved balls. The questions are there, the clinical scenarios are there. Clinical scenario might be a mess different, but you know the questions, okay? So know your stuff inside out. Don't lie. Don't lie. The person sitting across the table has been doing it for years and years and years, and they are very well known to, how to pick up any person who is lying, who's not telling something that's truthful. Be very truthful. And remember that this is a CSTEM interview, not an SPR interview. I'm looking for someone who would be looking for help, who'd say, yes, I can't figure out this on my own. I'm going to contact my registrar who knows the chain of command. I would like to contact my consultant for this. I need help. I'm not expecting that, yes, this is a STEMI and the cardiology registrar is not taking. What am I going to do? Oh my God, I don't know what to do. No, I'm going to escalate it. I'm going to ask for advice, ask for help. You are a CSTEM level interview. So the knowledge base that I'm expecting is an intern level knowledge base. Remember that the interns who are applying for this interview, so your knowledge base doesn't have to be massive. I'm not expecting to know each and everything. But I'm looking for someone who's looking for help, practice, record yourself, go back and forth, listen to yourself, what you're saying, how you're pronouncing things. And as I said, I want someone who will find me a solution to the problem, rather than create a problem, and be that person in your interview. That is all that I have to say. If there's
I
no
think
more
one more, Mustafa, one point. I don't know whether I joined a little bit afterwards. I think safe doctor is a very important thing which you mentioned. So we all are looking at this level, the doctors who are honest, safe, hardworking, and ready to learn. This is the key. So it's you're not here at the top level consultant interview. You are here to enter a system. So I think there was one question asked in the surgical trainees we were doing, that the question was thrown about some cancer patient. What they were looking for is that how to do the appropriate investigation, refer to the appropriate team so that you are safe. So I think if any those kind of hi-fi questions comes, just think safety in your mind and answer the question.
And it's very easy, and it's the safe thing to say that I think this is beyond my experience and expertise. I will need help. I will contact the next person. I will contact my registrar. If I can't find my registrar, I'll contact my consultant. If I can't find them on the floor, I'll pick up the phone and ring them, because this is something that is beyond my knowledge base, beyond my expertise. I need help, and this is not a bad answer. This is the answer that would make you more appointable. Trust me. Rather than someone who says, no, I'm going to stick a scalpel. I've just done the airway course day before yesterday, and what I'm going to do is I'm going to get the scalpel and make a hole in their neck, and then I'm going to so that is a complete fail. So I'm looking, as I said, I'm not looking for a cocky person. I'm looking for a person who's coming here to learn and go for. If there are no more questions, no more comments, I'm going to close the session here. Thank you very much, Dr. Waqar, Dr. Farah Mustafa, Dr. Abdullah, Rana, for coming. I hope Momena, Ibrahim, Bushra, Ogi, HK, all of you found this session useful. All the best for your upcoming interviews. If there's any other burning questions on your mind, feel free to ask us on our WhatsApp groups, and we'll try and answer them as we can. Thank you very much, everyone.
Thank you all. All the best. Enjoy the interview. Make it enjoyable for the interviewers.